Hello dear friends, welcome back. Welcome back to my channel. So today we are going to discuss about a nightmare to every medical student. So when they are going to face the practical examination, so first part of their examination will be histology. So all the slides probably they appear same, and the identification of each and every slide it is bit difficult. So I want to give you an idea how to identify the slides. So let's get started. Before going to explore this, please subscribe to my channel. And today's session, I am going to divide this entire slides into two parts, general and systemic. And today, I am going to discuss about general histology slides. In the next class, or next session, I am going to explain about systemic histology, and I will give you idea how to identify the slides. Let's get started, dear friends. The general histology slides which we are going to discuss are, we are going to see the cartilage, bone, muscle, nerve, and the lymphatics we are going to discuss. So first and foremost thing which we are going to see is the hyaline cartilage. How to identify the hyaline cartilage? So identification of the hyaline cartilage is, so entire the matrix it appears blue in color, and some places we can see the pink also. Okay, and the entire the chondrocytes they appears very clearly. Okay, so the group of chondrocytes we can identify, and the perichondrium also you can see. So if it is appearing blue in color, there is nothing but the hyaline cartilage, that is basophilic, homogeneous basophilic matrix. Entire this is blue in color, we can identify this is. And coming to the elastic cartilage, how to identify the elastic cartilage? So in this text, I have taken these pictures from the textbook and from internet. So in one textbook, I have found that, so it is also blue in color, but actually it appears eosine in color, pink in color. So another thing which we can identify are, things to identify are, it is also having perichondrium, and the matrix, in the matrix you can identify small fibers. They are nothing but the elastic fibers which are present in between the chondrocytes. Okay, so that is the identification of the elastic cartilage. And moving to the white fibrous cartilage. White fibrous cartilage identification is, so try to see here, this is a textbook image which I have taken here, the first image, and second image we can identify, it is a slide image which how we can see in the histology slide. So entire the thing we can identify fibrous part. Occasionally here you can see the chondrocytes. So the rows of chondrocytes were arranged. Here you can identify. So the chondrocyte number is very less. Here one, here one, here you can see one chondrocyte. So it is not same like the hyaline cartilage and elastic cartilage. And also we cannot identify any perichondrium here. Okay, so that is how we have to identify the white fibrous cartilage. Now these are the two important slides, and easily identifiable slides are the compact bone. So when you see in the slide, entire the slide appears in the black and white. I have taken these pictures from textbook. It is appearing little brown in color, but in the slides we can identify black and white. So we can identify these chondrocytes. They are circularly arranged. These are the nothing but osteocytes which you can identify. These are the Haversian systems we can identify clearly. So if you identify any circular structures black and white, that is nothing but the compact bone transverse section. And if you identify the osteocytes laminae which are vertically there present, if you see this Haversian canals, vertical Haversian canals, that slide is nothing but the compact bone longitudinal section. Okay, so two important slides easily identifiable. One is compact bone TS, circularly arranged osteocytes, we can have Haversian systems of seen. In vertical arranged, that is nothing but the compact bone longitudinal section. Then moving to the skeletal muscle. Skeletal muscle, how to identify the skeletal muscle? Here you can identify, this is a textbook image which you can identify. So these are the skeletal muscle fibers, bundles of muscle fibers. Okay, so this is the slide image. We can identify the skeletal muscle fibers which we can identify over here. And the nucleus, try to identify the nucleus. It is peripherally present. Here also you can identify peripherally placed multinuclear. So it is having many nuclei. So that is the identification of skeletal muscle. Okay, so you can identify clearly. These are they are present in the bundles. That is the main thing you have to remember. Now moving to the smooth muscle, how to identify the smooth muscle? Try to see here. These are all the spindle-shaped muscle fibers and centrally placed nucleus, flattened nucleus, centrally placed nucleus. Here also you can identify. So these are the spindle-shaped skeletal muscle fibers. They are having prominent nucleus inside. So this is the identification of smooth muscle. And these are the vertically arranged longitudinal smooth muscles. When you take a section, we can identify clearly the nucleus. Okay, this is longitudinal section, I mean TS, and this is LS. Okay, LS of smooth muscle. Okay, that is how we have to identify the smooth muscle. Try to identify clearly, find out how they are present. If you are able to identify clear nucleus which is present in every skeleton, in every muscle fiber, that is nothing but the smooth muscle. Now cardiac muscle identification. Cardiac muscle identification is try to observe the muscle fibers. So almost it appears like the skeletal muscle only, but they are present in bundles. But here all are separated with each other and they are connected with each other. Like here you can see the branches. So that is nothing but the intercalated disc. Okay, these muscle fibers are branched. Here you can identify one branch. And you try to observe clearly. These are every muscle fiber is having nucleus exactly at the center. Okay, so here you can see these are the nuclei, small dots like structures. These are nothing but the nuclei. Okay, so centrally placed nuclei and the muscle fibers are branched. These are the identification points also you have to write in the spot. Now moving to the peripheral nerve LS. So probably in every sections we might have the LS, and if you find the TS, that is nothing but you can identify the bundles of nerve fibers, nerve fasciculars. In the LS you can identify clearly the fibers, vertically arranged nerve fibers. Okay, so this is also black and white image we can identify. Okay, black and white bone and the peripheral nerve, they appears black and white. So okay, that is how we can differentiate the bone TS, LS and peripheral nerve LS. Okay. Now moving to the ganglia, there are two ganglia we can identify. One is sensory ganglia and the one is sympathetic. So how to identify the sensory ganglia? So sensory ganglia, we can identify the pseudo-unipolar neurons. These are all the pseudo-unipolar neurons. Okay, so these are the pseudo-unipolar neurons. Every pseudo-unipolar neuron, it is encircled by these black color cells are nothing but the satellite cells. Satellite cells number is more. Okay, this is a slide image. Okay, these are all the pseudo-unipolar neurons, and the outside of this you can identify here. Try to identify here. This is a prominent nucleus and the big nucleus. Cell size is also bigger. Neuron cell size is also bigger, and every pseudo-unipolar neuron is encircled by more number of satellite cells. Here you can identify one. This is also one pseudo-unipolar neuron, and this is one. So these are all the pseudo-unipolar neurons, and they are circled by satellite cells. So the number of satellite cells are more. So identification points to write is, so we can write the presence of pseudo-unipolar neurons and they are encircled by satellite cells. The number of satellite cells are more. Then let us move to the sympathetic ganglia. Coming to the sympathetic ganglia, the neuron size. Which type of neurons are present in the sympathetic ganglia are multipolar neurons are present. Even the satellite cell number is also less when you compare with the pseudo-unipolar neurons which are present in the sensory ganglia. Let me show you the slide image. So this is the histological slide image, how to identify the sympathetic ganglia. These are all the multipolar neurons. Can you identify here? So multipolar, these are having many poles, and the cell size is smaller when you compare with sensory ganglia. Cell size is smaller, and the number of satellite cells also less when you compare with sensory ganglia. And which type of neurons are present here in the sympathetic ganglia are multipolar neurons are present. Then moving to the cerebellum. How to identify the cerebellum? We can identify pyramidal shape cells You can identify pyramidal shaped cells which are apex are projecting upwards. So the multi nuclears. So multi-nuclei, there are so many nuclei we can identify. So entire the cerebrum, it is having 6 layers. 6 layers. So you can differentiate all the layers from above to downwards. Okay, so molecular layer, pyramidal cell layer, outer pyramidal, inner pyramidal cell layer, outer granular, inner granular. These are all the layers we can differentiate, we can distinguish clearly. Okay, so you have to see from superficial to the deep. Then you can identify different uh, layers of the cells, and we can identify this as a pyramidal cell layer. This is one pyramidal cell. Okay, so the big pyramidal cells are called as giant pyramidal cells. So you can write it as, so the different 6 layers of cells are seen, and the giant pyramidal cells of beds are seen in the inner pyramidal cell layer. Okay, so that is how we have to write the identification point for. Now moving to the cerebellum, what are the things to identify in the cerebellum? In the cerebellum, we can identify so different layers, molecular cell layer, then so this is a molecular cell layer. Then second layer is, can you see the flask shaped cells here? So these flask shaped cells are called as Purkinje cell layer. Purkinje cell layer. So this is very important specific identification point of cerebellum. Then moving to the spinal cord. How to identify the spinal cord? It is very easy, because for spinal cord they prefer they actually the spinal cord slide has been focused in simple microscope, that is dissection microscope. In the dissection microscope, you can identify, if you observe the dissection microscope, you can identify clear butterfly shaped gray matter, that is nothing but the spinal cord. So remember, spinal cord, they focus spinal cord, it is been focused in simple microscope. Even umbilical cord also focused in simple microscope. Okay, so remember these two slides, guys. Okay, that is about the spinal cord. So this is nothing but the gray matter, anterior gray matter, posterior gray matter, lateral gray matter, and you can write it as gray matter has been seen, white matter has been seen, anterior gray horn, lateral gray horn, posterior gray horn, anterior white matter, lateral white matter, and the posterior white matter. Anterior medial fissure and posterior medial sulcus has been seen. Any points you can write, dear friends. Now moving to the skin. There are, in the skin we have two slides. One is thin skin and thick skin. Let me show you thin skin first. So it is very clear image to identify thin skin. So this epithelium is stratified squamous keratinized epithelium. Stratified squamous keratinized epithelium, and you can identify this. What is this? This is nothing but the root of the hair follicle, and this is nothing but the sebaceous gland. So in the examination, probably they focus the root of the hair follicle and the sebaceous gland. These things they focus to identify clearly the thin skin slide. Okay, so epithelium you can identify stratified squamous keratinized, and then root of hair follicle, sebaceous gland has been seen, and you can identify small smooth muscle here, erector pylorum. Erector pylorum also has been seen. These identification points you can write in the spotters identification. Now moving to the thick skin. How to identify the thick skin? So thick skin identification is clear keratin sheet. We can identify clear keratin sheet. Is also the epithelium is same, stratified squamous keratinized epithelium, thick layer of keratin sheet. So if you remember the layers of the skin, you can write stratified stratum basale, then stratum spinosum, stratum corneum, stratum lucidum, stratum spinosum. After stratum spinosum, we can identify stratum granulosum. These are the keratohyalin granules. Then after that, lucidum. This is nothing but the lucidum layer, thick keratin sheath. Then above the lucidum, you can identify stratum corneum. So these are the layers you can write. So 5 layers can be seen in the epidermal cell layers. Okay, the hypodermis you can identify. Dermal papillae, and also the nerve fascicles, nerve fibers. We can identify the nerve endings, Pacinian corpuscles. These are all the things which we can identify in the hypodermis. Now moving to the blood vessels. There are elastic artery, that is large size artery, large size vein, medium size artery, medium size vein. So first thing is large size artery or elastic artery. So the large size artery identification is very easy because a small part of artery only can be focused in the 10x. So in the 10x we can identify clearly endothelium layer in the tunica intima, then subendothelial connective tissue, then after the tunica media it is consisting of abundant amount of elastic fibers. These all the elastic fibers can be seen. These are all the elastic fibers, and the laminae which you can identify here, internal elastic laminae, and outside will be external elastic laminae. Let me show you the histological. Yes, here you can identify. So this is nothing but the endothelium, and here you can see the differentiation between this endothelium and the tunica media, between the two layers, tunica intima and the tunica media. Here you can identify a laminae. That's laminae is nothing but internal elastic laminae. Then outside we can identify another laminae, that is nothing but external elastic laminae. Okay, so can you see the elastic fibers? More number of elastic fibers, very less number of smooth muscle fibers. Okay, and here you can see the vasa vasorum, blood vessels to the artery. So if you remember that, you can write identification points. Abundant amount of elastic fibers are present in the tunica media, and the vasa vasorum has been seen, and endothelium and internal prominent internal elastic laminae and external elastic laminae. Medium size artery or muscular artery. How to identify that medium size artery? So blindly how to differentiate without seeing that how to differentiate is, so you can see a big part of the artery, so that is nothing but the medium size artery or muscular artery. So in the large size artery we can identify only small part of the artery, but in the medium size artery we can see almost half of the artery can be seen in the histology slide in the 10x. Okay, so that is one. Blindly you can write it as muscular artery or medium size artery, and the identification points are smooth muscle fibers are present in the tunica media, and very less number of elastic fibers. Compared with the large size artery, here we can identify less number of elastic fibers. Same endothelium clearly seen, and the internal elastic laminae we cannot differentiate. Internal elastic laminae and external elastic laminae we cannot differentiate clearly as the large size artery or elastic artery. Large size vein. How to identify the large size vein? So large size vein identification is the smooth muscle fibers which are vertically present. So when you take a section, we can identify clear smooth muscle fibers here. Okay, clear smooth muscle fibers. So this is the tunica intima, and then in the tunica media we can identify smooth muscle fibers, smooth muscle fiber bundle. So that is the identification points of large size vein. We can identify the collapsed lumen also. Collapsed lumen, right? Collapsed lumen, smooth muscle fibers bundle has been seen in the tunica media, and endothelium has been seen. Okay, that is the identification points of large. Coming to the medium size vein. What are the structures? How to identify the medium size? So medium size vein identification is also same like medium size artery, because in the large size vein you can identify small part of it. In the medium size vein you can identify almost half of the vein can be seen. As we take the tissues from the lower mammals, so the structure, the size might be little smaller. Okay, smooth muscle fibers, circularly arranged smooth muscle fibers can be seen, and prominent endothelium, and external elastic laminae can be seen. Okay, and the vasa vasorum has been seen. So this is how you have to identify the medium size vein. You can study one other identification points in your textbooks, and you can mention that also in the. And moving to the lymphatic system, in the lymphatic system we are having four slides: lymph nodes, spleen, thymus, and palatine tonsil. Let me discuss about these four slides. First one is palatine. Yes, coming to the first thing is palatine tonsil identification. So palatine tonsil identification is very easy. Try to identify the epithelium, stratified squamous non-keratinized epithelium, and we can identify lymphatic nodules in the submucosa and the mucous acini. So these three things you remember: stratified squamous non-keratinized epithelium, lymphatic aggregation, and mucous acini. If this lymphatic aggregation is absent, definitely it is esophagus. Okay, If this lymphatic aggregation, lymphatic nodule is absent, only stratified squamous non-keratinized epithelium and mucus acini has been seen. There is definitely there is esophagus. If this lymphatic nodule is present, that is nothing but the palatine tonsil. This is the main differentiation between palatine tonsil and the esophagus. Okay, so esophagus I am going to discuss in the next session. So in the high power you can identify clearly stratified squamous non-keratinized epithelium, lymphatic nodule over here, and these are the nothing but mucus acini. Okay, so 3 points to remember, 3 things to remember to identify the palatine tonsil. Next we will move to lymph node. How to identify the lymph node? So lymph node identification is also very easy. You can identify the capsule here. This is the capsule. Then below the capsule you can identify subcapsular sinus and the invagination of the capsule called as trabeculae. And here also you can identify lymphatic nodules. In the lymph node you can identify lymphatic nodules in the outer cortex. And inner medulla you can identify medullary cords. We can identify in medulla. Okay, in the context you try to identify lymphatic nodules. So germinal center, this is nothing but the germinal center, lymphatic nodule, invagination of capsule called as trabeculae, capsule, subcapsular sinus. So that is the identification of lymph node. Then spleen, how to identify the spleen? Here also it also appears like the lymph node only, capsule will be present, but here we cannot identify subcapsular sinus, but you can see the invagination of capsule occasionally inside. The trabeculae can be seen, and the germinal centers, lymphatic nodules, and every nodule it is having an artery. So eccentric arteriole. Here you can identify eccentric arteriole. Here you can identify, and here you can see that eccentric arteriole. So this is how you have to identify the spleen. And moving to the thymus, how to identify the thymus? So thymus, when the slide has been focused, you can see all the thymic lobules has been properly separated by septum. And if you observe one thymic lobule at the center point, you can identify some dark areas, dark pink color areas, that they are nothing but the Hessel's corpuscles. Okay, this Hessel's corpuscles, it is very important, and it is a main identification point of thymus. Okay, Hessel's corpuscles can be seen, and thymic lobules. Thymus is separated into thymic lobules by a septum, prominent septum. That is the identification of point. So thanks for watching, dear friends. So this is how I have to identify the general histology slides. In the next session tomorrow, I am going to post the systemic histology also. So you no need to worry in the examinations. When you got a slide, you try to focus and try to see all the field. Then only you have to come to the conclusion. So don't come to the conclusion by seeing only one specific point. So when you got any slide, you try to focus all the field, search all the field, try to find out all the features, then only you have to come to the conclusion. See you soon, dear friends. All the best.